All right, so we will start. So thanks everyone for coming to our the IR grand round. So we have a special guest. We have a special guest today. So Dr. Benjamin Doolittle. He's a fantastic physician. But also he was an ordained minister, so he has a sort of different perspectives, perhaps, or additional perspectives to medicine. So he did entire training at Yale. He did the undergrad, the medical school, divinity school, and then the medicine residency, pediatric residency, all at Yale. He's the director of the MedSpeed's residency program, as well as the director of continuity care in medicine, practicing medicine and the pediatrics. And I think that he has a focused interest in the medicine, spirituality, well-being, and physician burnout. I think it will be a fantastic, interesting talk. Thank you.
Thanks, Dr. Kim. And thanks, everybody. Grand round, 7:30, and you guys showed up. It's like so great. We're going to talk about the physician soul, an open-ended, vast, broad topic. And Dr. Kim and I met at an oncology retreat. And it's always nice if someone invites you to speak after they actually saw you speak. So here we go. We're going to talk about the physician soul, all kinds of disclosures. I've written several books that have sold dozens of copies. And besides that, I know many cool people and they don't have any cash. I would love to be in the pocket of somebody anyway. And then the other disclosure, as Dr. Kim shared, is I'm an ordained minister. And so if you come to my residency program, there's about an 80% chance that I'm going to officiate your wedding. And so this was a wedding of one of our medical assistants. And anyway, it's just a lovely facet of program directorhood. Here we go. So the story is this. Here's the case. I'm a huge fan of The Walking Dead, and because of my loose parenting skills, I watched The Walking Dead with my tween daughter, and usually we had this kind of special Walking Dead blanket, up to the chin there, and as you guys know, the zombie apocalypse, the depravity and collapse of society, and there's this one scene where the protagonists are kind of staggering down this country road, and they're looking wasted and bedraggled. And my daughter said, "Dad, they look just like the zombies." And sure enough, behind them are the actual zombies with their skin kind of sallow and in their, peeling off their face and all this. And later on in this scene, I think we were kind of binge watching through season 4. There's this scene where there's this shack in the middle of the woods with this huge rainstorm, and surrounding this shack are the zombies, the zombie horde crashing into this shack. And Rick, the star, the kind of thickly bearded, swarthy fellow, is talking, rallying the troops, and he says, "We are the Walking Dead. We are the Walking Dead." And then there was the guy, Daryl, with the crossbow guy, and he says, "No, we ain't them. We ain't them." And that line blows my mind, right? Because when the show, you think The Walking Dead is about the zombies, but it's not about the zombies. It's about the people. And because I work at an academic medical center, and because I'm on that publish or perish mill, I had to turn my affinity for The Walking Dead into an academic project, and so I wrote about it. Are We the Walking Dead? Burnout, a Zombie Apocalypse. So that's what this Grand Rounds is about, the soul, the zombie apocalypse. The Walking Dead. So, here is the question. Is this true or not? Are we physicians in the midst of the zombie apocalypse? Is there any truth to that? Are we the Walking Dead as we stagger into the hospital as on a cold November morning to grand rounds at 7:30? How is this true? How is this not true? So here's the story. Many years ago, I studied the residents in the Department of Medicine. There's all kinds of studies out there, but it hadn't really been studied so well among residents at the time. So I ask you this question. Among residents at Yale, internal medicine and med-peds residents at Yale, what is the prevalence of burnout? Give me a number. So 30%, 50%, 70%. Who says 30% burnout? Okay. Who says 70% burnout? Okay. All right. Who says 50% burnout? Okay. So people are kind of leaning to the 70%. Are there residents here or fellows, IR fellows? You guys are like, yeah, definitely 70% at least. Maybe higher. I don't know. So when you study burnout, there's this Maslach burnout inventory. So there's a codified, validated instrument that looks at emotional exhaustion, something everybody here knows well, that idea of being wasted, more than just tired. And then there's this idea of depersonalization, right? The idea of the patient as an object. And then there's this concept of personal accomplishment. Am I making a difference in the world? Am I making a difference in the world? So those three domains hang together. And here was the results. So residents in the highest tier of emotional exhaustion was 86%. For depersonalization, 89%. And for personal accomplishment, so low personal accomplishment in that lowest tier, only 8% of residents felt they had low personal accomplishment. And 71% were in that highest tier of personal accomplishment. I find this fascinating, right? So here's this group of people, just like you guys, working hard, emotionally exhausted, the end of the day, the beginning of the day, being tired. That quality of depersonalization, maybe it's some kind of coping technique, right? The alcohol detox lady in room 32, right? That quality of objectifying the other. So all that's going on, and yet residents feel, for the most part, like they're making a difference, like their work matters. I think this is really interesting because it gets away from this idea of like, oh man, all physicians, we're all such a burned out bunch of people. Well, it's much more complex than that and much more nuanced. So what made a difference? So in this survey we did, I tried to get at everything, right? I tried to do mentors, research activities, exercise, friends, time out with friends, time out with family. What do you guys think made a difference? Give me a shout out. Who said that? Who said someone said something? Sleep. Fair enough. I didn't ask about sleep. Sleep's a really interesting, sleep. Good point. Mentors? Maybe mentors? I was into research activities because if you were so passionate about something, maybe research. I was interested, one of my residents sang in the community choir. She seemed pretty happy. So I asked about outside activities. What do you guys think? Anything make a difference? Thank you. You're absolutely right. Because nothing made a difference. Not a single activity. Now, there were two problems with the study. One is I did the study in February in New Haven, which is a terrible time to do research on burnout. Yeah, so that. And there's all kinds of correlation and causation and all kinds of things. I was really gunning for the mentors, right? Because as a program director, we could just turn the mentors up to 11. But nothing. So no behavior made a difference. Now, there was this other stuff that did make a difference, which I think is very interesting. So there's this app that we run. So our emotional coping, like what is it in our hearts, that helps us get through this busy day. So there's this idea of active coping. That's the resilience, right, that we hear so much about. Resilience, active coping, acceptance. I'm getting called in the middle of the night. I got to go do this procedure. That's okay. I can do this. And then positive reframing is, I'm getting called in the middle of the night to do this procedure, but then I get to work with the best people in the world. And I get to be closer with my colleagues, and I'm making a difference. Now, in the spirit of disclosure, as a ordained clergy person, I was gunning for religion. I thought maybe religious involvement would make a difference. And it did. Weakly so. There was a weak involvement around religious constructs, about attendance and prayer and belief in a higher power and faith. But there was one quality about religion and spirituality that was the most powerful. Among the most powerful of the correlation coefficients was this idea of humility. And this is the interpersonal quality of forgiveness and reconciliation. So this is the person that you work with who will readily admit that they made a mistake. I made a mistake. Or if you say to them that you made a mistake, they forgive you. This quality of humility, forgiveness, and reconciliation. That word humility it sounds like a weak word. I like the word moral courage, right? This idea of owning what you do and seeking reconciliation. That was one of the strongest variables in this study. Never been written about, never been tapped, but I think intuitively we know this, right? Intuitively we know this. The person who's going to blame others, the person who's venting, the person who's crabby, we don't want to work with that person. But the person who supports me, the person who, doesn't have an ego, that's the person I want to work with. Very fascinating that piece popped a little bit in this study. So that was the study among the residents, and that was really the study that got me into this area. So what about us? What about people like us? So this study came out a year and a half ago. There's this group, Colin West and Tate Shanafelt out of Mayo. This was published in the Mayo Proceedings. And these guys, they make a career out of studying burnout, and they're really great, and they do a lot of really interesting work. But this was their latest paper that looked at about 8,000 physicians across the country by specialty. So on this axis is burnout, right here, and this axis is satisfaction with life. What do you think the average physician burnout is in the country? 30%, 50%, 60%, 70%. Someone shout out a number. 50%, 60%. Over here, gentlemen. 60%, 50%. Okay. And now over here is satisfaction with life. What is the average percentage who feels they have good satisfaction with, work-life balance? Work-life balance. 50%, who said that? Over here. Anyone saying higher? Anyone saying lower? 40%. Okay. So here it is. So you guys, that's pretty good. So average was 54%, prevalence of burnout using this Maslach inventory. And it was about 40-something, 42% people satisfied with work-life balance. But it's really interesting, right? So there are you guys, radiologists, and you guys are a separate breed. I'd be interested to hearing about, like, well, the interventional guys are like this, but the diagnostic fellas are more like that. I don't know. Who's more burned out, IR people or DR people?
I think it's apples and oranges.
Apples and oranges? Yeah, interesting. I actually looked it up. I did a little, lip biopsy, and there's no study among IR specifically that I found, interventional radiologists, but among radiologists in general, it is about that number, 60%, 50%, kind of in that range. But what's fascinating about this table, there are a lot of interesting things about this table, is that look at internal medicine, orthopedic surgery, radiology, they're clustered together, right? And those are pretty different subspecialties. Those are pretty different specialties that are nonetheless clustered together. And then there's like the ENT, OBGYN, pathology. That's sort of interesting that they cluster around the middle, anesthesiology. They're all different. There are our colleagues in emergency medicine, more than 70%, but more satisfied with their work-life balance, clocking out the 13 shifts a month. And then over here, the preventive occupational medicine folks, mostly a healthy group of people, maybe. Looking up some population health kind of approach, maybe. As a med-peds physician, it's really interesting how the pediatric folks swinging in the green zone and internal medicine in the red zone, they're similar, right? A lot of heavy outpatient, a lot of big patient volume, but they're pretty different across the spectrum. Doesn't seem to correlate so much with how much money people make. Doesn't always correlate so much with, not always, with work hours. Pretty interesting, I think. Do you folks have comments about this? Does anything strike you all?
Has anybody looked at, I suspect a lot of these differences are due to who goes into these different specialties.
Selection bias.
What their motives were.
Yeah, unpack that some more.
What their expectations were.
Speak to that.
I think a lot of people went into radiology with the expectation that they'd be up there. And sitting in front of the reading station for 8 hours is not what they signed up for when they went into radiology. And I think likewise, people go into pediatrics, they're not going into it with the expectation of making big bucks. They're going into it with the expectation of taking care of kids.
Yeah, fascinating. You had your hand up.
Yeah, I think overall it also reflects a very ill picture. I mean, satisfaction is never over 56, 57%. And everything's clustered around 50% or 46, 47% satisfaction. It's almost like a toss of a coin.
Right.
It's a bigger problem there.
Actually, that's an excellent point, right? It looks like there's this big spread, but when you look at how the axes are, everyone's sort of clustered around the same. Yeah, it's a good point.
Satisfied. I mean, they're whether burned out, satisfied, or they're not satisfied, not burned out, or burned out and not satisfied. Nobody's happy.
Right, which is why we're here talking about the zombie apocalypse and the physician soul. Yes, sir. Any other comments?
Dr. Doolittle.
Yes.
So just looking at the radiology specifically, would it be fair to say that in general, the radiology specialty, the work-life balance is average compared to other specialties, but burnout is higher in the spectrum compared to others, or as perceived?
Well, that's what the data show. Would you folks agree with that? Does that feel about right? It's a fascinating idea, right? Because it's hard to get into a good radiology program, but that image of sort of being alone in front of a reading station, and it's fascinating too, right? Because as a resident before PACS, we would come down and do radiology rounds. So the radiologists, you guys were at the center of the hospital. Everybody was coming in and out of your department, and now it's just different, right? We just call up the image, and there's less of that kind of glue that happens, maybe.
The other thing is this is a snapshot. Radiology just a couple of years ago was another part of this chart. It's moved to that part only recently, and so there's a lot of movement in these things.
Indeed. Good point. All right, let us press on, friends. So what makes a difference? Are older physicians burned out, or are younger physicians burned out? Who says older physicians are more burned out? Who says younger physicians are more burned out? So it tilts towards younger physicians. Why do you guys think that? Someone over here.
There's more younger in the audience.
Okay. Fair enough. So in general, it is younger physicians that seem to be more burned out. And the idea is because you got a bunch of debt, your kids tend to be a little younger, so that's a stress. Maybe that first job that you have isn't the one yet you thought it was going to be like. Whereas, and then there's the dropout, right? So some physicians stop being physicians, so they're not in the pool. And by the time you've been out about 15 years, and what's interesting is that that number 15, in my review of the literature, is the same for social workers and teachers and police officers. And that once you hit about 15 years, you found your job. That kind of fits with your mentality. So you got to keep going until about being out 15 years. I know that sounds like a long time, but all right. So married versus single. Are married physicians more burned out, or are single physicians more burned out? Married physicians more burned out?
Depends upon the gender.
Say that. Who said that? Speak to that.
If you're a man or a woman, I think it's different.
Yeah.
It's been shown outside of medicine. The married men are happier than married women in general.
Yep, you're absolutely right. So in general, married physicians, no, you're absolutely right. So in general, married physicians are happier than unmarried physicians. And it's interesting because in these studies, they do marriage versus not marriage, not in long-term committed relationships. So it's a tricky variable. But you're absolutely right. Some of the gender roles still play out in the year 2017. Women versus men. So women a little bit more burned out than men. Kids, presence of children. Does that make you more burned out or less burned out?
Depends how many.
Who says that children make you more burned out? The work-life balance, you think? Who says children mitigate burnout? Children make you feel better without your job? Yeah? Does anyone have a strong feeling about that they want to share? What do you think?
Maybe kids give you more meaning in life.
Yeah, interesting. So in general, that's true. Especially that depersonalization, that sort of objectified, it's hard to, if you've ever taken care of a kid with a fever, your own child who's throwing up, has a fever at 2 o'clock in the morning, it injects a little bit of humanity and humility into our lives as physicians, taking care of other people's children who are throwing up and having fever in the middle of the night. So kids, and then hours in practice setting and patient contact. In general, physicians who work less and have less patient contact tend to have higher job satisfaction and lower burnout. And then the practice setting is really interesting. It doesn't seem to be a clear domain in the sense that sometimes hospitalists are more burned out than the office-based people. Sometimes the academics are more burned out than the folks in the private practice. It's all it's a little across the board. But it does seem that physicians who have a varied job jar tend to be happier. So physicians who, have med students, serve on a couple of committees, make an intention to do continuing ed, go off to the conferences, those physicians tend to be a little more engaged, tend to be a little more satisfied with their job. So this is a shout out. So that's just demographic stuff in broad strokes. I'm a program director. Is there a program director here, a fellowship director here? All right, for IR?
Yeah.
Yeah, so this was a big survey among the program directors, and this is just to point out, I won't dwell on this too much, but so internal medicine program directors, prevalence of burnout was less than 30%. It's interesting that the program directors are a lot less burned out than the med students, who are about as burned out as the residents, who are almost as burned out as practicing physicians. The worst thing you can be is a clerkship director, and the idea is you don't get enough support. Clerkship director. But the worst thing for a program director, is if you get promoted to be a dean, then your burnout prevalence goes up. But the other piece that's interesting about this is that medical students are burned out, the residents are burned out, and the physicians are burned out. And there have been inklings. It's hard to study, right? Because you got to do a real longitudinal study. But the idea is, the thinking anyway, is that it starts in medical school, and that in my study of interns during their orientation week, interns show up burned out, and that it just keeps on going. All right, and there's all kinds of interesting studies about this, but it's the sad state of it all, that if you're burned out, you tend to be divorced a little bit more. You tend to meet criteria for depression, maybe drink a little bit more than you would. This job turnover and absenteeism is very interesting. So the idea is that if you're burned out, well, you're going to leave that job and hoping to find a better job. You call out a little more often. There was one, this was kind of written in this discussion of one of these papers. It's hard to study, I guess. But they said that a physician loses, a burned out physician loses $10,000 a year in salary over their career. That's really interesting. That's going part-time or switching jobs and things like that. I'm not sure how they measure that, but it's a provocative idea that it impacts your bottom line. And then there is a lot of interesting stuff around quality of care and unprofessional behavior. The idea of not meeting core measures, right? So you didn't order the aspirin in someone who had a heart attack, that you forgot to order the flu shot and the pneumonia shot upon discharge, all that kind of stuff. And then there's this interesting thing about medical students lying on rounds, that the idea of, the vitals were normal or the labs were normal, and they didn't know. They just didn't know. Some provocative stuff around that. I think this is really important for hospital administration, in the sense that now hospitals, we are getting dinged on the 30-day readmission rates for CHF and all of those bundled payments, and that we get hit, we don't get reimbursed for readmissions. And so it's provocative, I think, that burned out physicians providing suboptimal, dangerous care impacts the bottom line of a hospital. The other piece that's important is how much does it cost an institution to replace an internist? I don't know the cost for a radiologist, but how much does it cost in terms of lost income, in terms of recruitment, in terms of getting a new physician up to speed? How much does that cost? $50,000, $100,000, $250,000. What do you guys think?
250.
Exactly right. $250,000. So this idea of burnout being, it's my fault because I'm not doing yoga at 7 p.m. or it's my fault because I've been doing charts until 9 p.m. and I didn't make it to the kids' soccer game and I'm so burned out that it's on me, right? That's sort of how the tone of these studies go, right? It's my fault, my fault, my fault. but it actually impacts our patients and it impacts the institution. So I've been interested in this idea to try to get away from this idea of burnout being something about me or something about you, your wiring. I was really interested in this idea of secondary trauma. The idea of, I'm next to patients all day long and they're sad and they're suffering, and at the end of the day I feel like I'm suffering. I acquire their PTSD. And then the flip side of that, and you almost never see this idea of compassion satisfaction. I just spend all day seeing patients. I love what I do. I feel like I made a difference in what I do in these patients' lives. So what's that idea? That idea of compassion satisfaction, that my job actually feeds my soul and makes me happier. So that's an interesting construct. And there were a bunch of things that haven't been measured well in the literature. This idea of resilience and grit has been a hot variable lately. Exercise, one of my colleagues really thinks that, if you exercise more, you feel better, which is, I think, true. But more importantly, I think is this idea of culture, getting away from the idea of burnout being your fault or my fault, but something about the institution where we work, the culture where we work. And within that, I actually was really interested in friendship. This idea, call it the pub space, if you will. Like, we have our work colleagues, and we enjoy them and love them, and maybe they're even our friends. And then we have our families at home. But let's face it, maybe our spouse doesn't want to hear it all the time. But do we have this glue, a friend that supports us in our life, this sort of web? So I was really interested about that. So this was a study that we did among the American College of Physicians. And I want to get away from actually these kind of studies where you fill in bubbles. I think it's much more compelling to just talk to people. And so I think these qualitative studies might give us more information. But nonetheless, so this was a study that we did among the American College of Physicians. We took a population of physicians, and we asked all about demographics. We asked about compassion, satisfaction, and resilience, and spirituality, exercise, friendship, all of this stuff. And this is what we found. So we got 300 or so surveys back. This was the demographics, pretty predictable. So, 56 to 44% men, women. Average age was 52. That feels about right. Years in practice was 20 with the big standard deviation. That made sense. Married, single, divorced, widow. That felt about right. Average salary, $219,000. That feels about right with the big standard deviation. Some people made more. Some people made less. Some were working part-time, they said. So this was what we got. And this actually feels right, too. So 52% met criteria for burnout. 23% self-identified as being depressed. 61% said they were spiritual. 38% said they were religious. 71% said they exercised. 83% said they had a close friend. That dialectic of being spiritual and not religious, or religious and not spiritual, I put that in there just as a interesting twist. So I asked people to write in what were the things that stress people out the most. So predictably, it was this idea of being a hamster on a wheel, EMR, 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 no time paperwork, EMR, lack of control, unrealistic expectations, great point there, being blamed for things over which I have no control, such as whether a woman has had a mammogram. I can write an order, but short of placing her breast on the plate, there is not much I can do to make sure it happens. I could go on for hours. And I asked people to write in what helped. Family, friends, humor, taking joy in accomplishments, meditate, tough it out, cry, Netflix, teaching, selective norepinephrine reuptake inhibitors, wine with dinner, and then not very well. So this was a snapshot of, these are our people. People in Connecticut, people in upstate New York. These are our people. And so this is the demographic slide that affirms the literature. So the older you are, the less burned out you are. The older you are, the lower your secondary stress, your secondary trauma. The older you are, the greater your compassion. And there's some of that demographic stuff that was really interesting. For some reason, the VA folks were a little bit more burned out and a little bit less compassion, which is interesting, right? Because I see that as more of like a controlled environment. Don't know where that is about. Inpatient, outpatient, both. So practice setting among internists, no clear pattern. But this is the part that I think is really interesting that I want us to think about together. So resilience, Stephen Southwick, this wonderful psychiatrist out of the VA, wrote about grit or defined resilience among Vietnam veterans who came home. And his book, Resilience, is just so interesting. He looked at Vietnam veterans who came home and then were successful, who had flourishing lives, and wrote about it. And then it's been disseminated in popular culture, but he's the one that defined this, and he's works in the next town over. So this idea of grit, this idea of resilience, the grittier you are, the less burned out you are, the lower your trauma, and the greater your compassion, which I think is fascinating, right? This idea of resilience, you're toughening it out, impacts your sense of compassion, or has a relationship with your sense of compassion. And then I'm really interested in this institutional support. Now there aren't great validated instruments, so we constructed our own. How well does your institution support you? How well does your supervisor support you? It's very interesting that if you feel like you're supported by your institution, you have lower burnout, lower secondary stress, but greater compassion. Greater compassion. That's fascinating. And then this idea of friendship. If you have a friend that you can rely on, it lowers your sense of burnout. It increases your compassion. I think this is very provocative and very compelling. Do any of you have strong reactions to this at all? All right then, let us press on. And this was a validated instrument about exercise, which I think is true, right? If we go to the gym, we go to the gym, we think that was great. I should go to the gym more. I feel terrific. And so this was an instrument that's validated for middle-aged people. 20 minutes, 3 days a week. And if you do that, you have lower burnout and lower secondary stress and more compassion satisfaction. And then I asked these same emotional coping variables, which were predictable and affirmed what we found among the residents. So this idea of acceptance. This is happening to me. This is my life. This is my job. This is my vocation. My role in the world. And if you have that, it affects all of those things. Active coping is slightly different than just acceptance. It's this idea of hanging in there, a little bit more of a perseverance. Positive reframing is this looking on the bright side, and strategy planning. This is what we do every day. This is the checky box, right? This is when you fill out your checky boxes, and at the end of the day, if all your checky boxes are filled in, if there's that sort of mentality, that goal-directed, making a plan, that impacts your burnout and your compassion as well. The tricky thing, or the interesting thing, the psychologist who designed these instruments, the emotional coping strategies, talked about how it was hard to change. That if this is the app that you run to cope, it's hard to jump from being someone who does positive reframing into being strategy planning. And more to the point, If you are the kind of person who vents or is it denial, who practices denial or disengages, it's hard to switch into this. Now, I don't think that's completely true, but that's what Carver, the person who invented all this, talks about. So if you deny what's happening, your burnout, secondary stress, and compassion satisfaction is impacted. Disengagement, very interested in disengagement. Disengagement, I think, is a late finding. This is this idea that you don't care anymore, that you've detached yourself from finding meaning in your work. This self-blaming behavior, same thing, substance abuse, and venting. I'm intrigued by this. Some hospitals will have this no venting policy, especially in patient areas. And I think that makes sense, right? Like you sort of get it all out, but it doesn't make a difference, I think. So that's the app that we run. Now, the other thing that was interesting that was not significant was salary. So how much money folks made. And then also, I thought religion would make a difference, or maybe being spiritual but not religious. Maybe that would make a difference. But it didn't make a difference among physicians. And I find this very compelling because in almost every other study, religion and spirituality makes some difference. That religion and your spiritual life impacts things like life satisfaction, longevity, mental health, depression, substance abuse, that in almost every other population, religion and spirituality makes a difference. And among physicians, or at least internal medicine physicians, it doesn't make a difference. And then I ask the question, is it something about who we are that we're, or is it something about the culture in which we live? Are religious institutions not reaching physicians well enough? I don't know. But it's really interesting that none of these domains made a difference. And I used this validated instrument that looked at organized religion, that looked at private practices, prayer, meditation, and also belief systems. This idea that do you believe in a higher power? Do you believe in that your life has purpose and meaning? So none of that made a difference. Really interesting. Any responses or questions to any of this stuff? All right. Let's keep going. So the question is, are we the Walking Dead? Is this the zombie apocalypse for us? Well, no. I shouldn't say no with an exclamation point. Maybe no with a question mark. It's hard. We got to think about this because we're still in that shack in the middle of the rainstorm with the zombies beating against us. But where do we go from here? So I think we need to change the language we use, because in the same way that the TV show shows that we're in this post-apocalyptic world, I think we're in this post-burnout world, that we've heard enough about burnout. We've heard enough about how bad it all is. We've got to change our language. I don't like this word wellness. Some institutions, our institution, start talking about having things like wellness committees or wellness curriculum. Wellness curriculum, I don't know. That seems tiresome to me. Grit, important, not enough, I don't think. Work-life balance, I don't like that phrase either. This idea of my life is my work, but I want my work to be part of my life. And it makes it seem like work is the bad stuff and life is the good stuff. I want both to be good. So I think we're looking for a new word to describe what we're looking for. I like the word flourishing. I love that word, flourishing. One of our, this wonderful theologian up at the Divinity School wrote this book called Flourishing, and how religion could be an helpful way to make people's lives flourish. I love that word. When I float the word among colleagues down here, I get sort of the eye roll that it implies, prancing through a field of daffodils or something, which I think is a good idea. But I like the word thrive. That the question for us in our institution is how do we have a life of thriving, that's more than just wellness or work-life balance, but how do we really flourish or thrive? So I think we need to get away from this idea that it's my fault, that it's just me, because I didn't make the soccer game and I'm staying up too late doing charts. But at the same point, there's stuff that is my responsibility, right? So I got to at least think about my spiritual life, my inner life. I got to at least think about this concept of humility and reconciliation, how I cope, my emotional coping, my sense of grit or resilience. And then the other side is for the leadership in the departments, the program directors and section chiefs and all that stuff. That we got to think about the culture and the garden in which we work, and what do we do to help make the culture, help our colleagues thrive. And it's not enough to say, 7 p.m. we're going to have a class on yoga and meditation. I don't know. It's not. That sounds exhausting to me, right? Like, how do we keep it real? How do we make it real? I'm intrigued that square friendship probably belongs in the middle, right? Although there have been these really interesting studies about people who stay in their job. People who stay in their job, one of the strongest variables is if they have a best friend at work. If they have a best friend at work, they're more likely to stay at their job. And we all know that it's never our job, that it's always personal. It's never policy, it's always personal. So I'm interested in that, in thinking about that. This idea of, how do we make it real? But it's also interesting, this idea of, if I've been out 15 years and I'm burned out, how do I switch from being someone who's disengaged? How do I switch to someone who does active coping or someone who has higher resilience? How can it be taught, some of these things? And I don't know if it can be taught. I know it can be modeled, right? Because we all know physicians who are happy, who are satisfied with their role, and we want to be like them. We want to be like them. So there are a couple things. There's a wonderful writer, Mark Linzer, put out a position paper for us to think about. So one of them is institutionally, folks should make satisfaction a quality indicators. That when I log into MedHub, I see the CALIs and the WALIs and the BALIs, the catheter-associated line infections and the flu shots. Wouldn't it be interesting if every quarter we had a prevalence of burnout in the work among physicians and nurses, that it was a number that we measured? So we did that in GME. We put burnout questions, and if you invite me back, we can talk about it. We have to mindfulness is an interesting variable, but optimizing the electronic health record is super important. The way we think about our FTEs, and could it be possible to have lower FTEs or count things for a greater chunk of your FTE? And then this idea of going part-time or job sharing and all of that. And I also think in inoculating the sense of self-care into the profession, that making that part of our language. So we have a few minutes. There's a couple good reads. I could talk about them, but I won't. We have 2 minutes or so. Any questions, thoughts, reactions? Hit it.
I'm actually going to quote you from when I was a med student. You said something like that depression and some of these processes of burnout can be part of a process, almost like a hero's journey, that it's kind of a natural part
Oh.
of our emotional development. And so I wonder, like, how much of it is that, like, we kind of have to go through some dark times to experience resilience and then be better in the end.
I like that. I like that a lot, right? Because it gets away from burnout with this loaded pejorative term that, and I like the idea of the hero's journey. You know, we're all on an odyssey. And then what do we do with that, right? So we've just spent the day, you know, I do my ER shift and I have this horrible experience, you know, a young person dies, and then what do I do with that emotional baggage? And do I turn it into something that deepens my soul, or do I become, you know, does my soul become calcified so that the next patient, I don't feel it as much? I don't know. So I love the hero's journey.
I think there's just more movement there than we appreciate. It's not like a static thing.
Yeah, I agree. And this idea that you could be really emotionally exhausted but feel like you're doing a really good job too. Like you have high personal accomplishment in your job, even though you might be like exhausted and all that. Yeah, it's a really thoughtful, that's a good point. Other thoughts, friends?
I have a question.
Yeah, hit it.
You know, the maybe different generations, but when I was in the medical school, nobody asked me if I were burned out.
Yeah, they just assumed you were burned out. Yeah.
But this is the first time I'm seeing data of medical students. Did something change, or how? Because the residents and on, interns and on, of course, all of us have jobs to perform. But as a student, I mean, our job were studying. How does that? I don't know how to internalize this data.
Yeah, it's a good point, good question. I think it's interesting that the prevalence of burned out medical students and the prevalence of burned out residents is about the same. And there's a lot there. I don't know, being a medical student is stressful, right? You're taking out huge loans. We get judged all the time, right? Medical students in this way that, you know, maybe you got into medical school because you filled out the bubbles right on the test, but now you're being judged on all of these intangible ways, right? Like how you present patients, how you interact with nurses, you know? It's much more subtle, I think, maybe. Other thoughts? 1, 2, and then we'll close.
Yeah, so just maybe a comment first, and that is, you know, the first time I saw the definition of ADHD, I go, wow, that fits me. I've got, activity disorder there. And then I read the one for autism, and I go, that kind of fits me a little bit too. I think the problem is the definition for burnout, you can read it, and you can say, yeah, that kind of fits me, and really it's not like slow and insidious, it kind of waxes and wanes, right? You have a bad day, you have a complication, you stay, take care of a patient, you miss your daughter's play, and you go home and you're saying, this place sucks, it's stealing your life away. The next day you have a good day and you feel better, and just, like I said, I feel like the definition fits us all at any one particular time. Yeah,
fair enough. Although the literature on burnout is that it's this psychologist Carolyn Maslach started this in the 1970s. And the idea is that you can have good days and bad days, but burnout really is this definition that you show up and you're emotionally exhausted and you're disengaged as sort of your chronic state of being. Anyway, but good point too, that it waxes and wanes. Last.
Burnout was all defined as like not burnout in like a point in time, but just like sustains.
Yeah.
Over.
So it's great that we're studying all this among the physician groups. Any sense that the hospital administrators were leading charge and care about this at all?
Yeah, so there is actually. So there are these, so Ron Vender has been convening, and Sandeep Mukherjee has been convening meetings once a month to address this. So it's part of the dialogue, and we got to try. We got to try. I mean, it's interesting, right? The idea that it impacts the bottom line of hospitals and patient care, I think, is really compelling from an institutional point of view. And then the idea of talking about the culture of our institution beyond all the other aspects of culture that we need to address, like racial discrimination and gender discrimination, but even the sort of, I don't know, I like to think of it as a garden, right? How do we have a place where we can grow and thrive and be joyful in our work, you know? And dare I say, these are spiritual terms, right? These are, I'm reading this book, Courage to Teach, you know, by Parker Palmer. It talks about the inner life of teachers. And it's fascinating that an academic sort of is appropriating this beautiful language of joy and flourishing and thriving. But let us close with this idea that we're on a hero's journey. So we're on a hero's journey. Thank you for having me. I'll stick around and visit for folks who wish, but thanks for having me. Thank you so much.
Great. Thanks.
Hey, I got a... Yeah, cool.